Welcome to the Integrative Shift, reimagining the future of medicine with pioneers in the field. In this series, we explore doctors' journeys from allopathic medicine to integrative medicine and how it benefits their practice, their patients, and themselves. Today, I have the honor to interview Dr. David Nye, who is one of the founding members of SASIM and also one of our directors. So, thank you so much, David, and welcome.
You're welcome, Elva. Nice to be here.
I'm really keen to hear your story because I think I've actually ever heard it properly. So let's get going. What first led you to explore integrative medicine?
I think it goes way back before we even talked about integrative medicine, when I was first introduced to homeopathy and complementary medicine. And I was very young in my general practice, and I spoke to a rep from one of the homeopathic companies, and he introduced me to echinacea, and I started using it in the practice. I found it was great for people who had flu and things like that. And I started exploring more and more herbal and natural homeopathic medicines. And then I was in the very fortunate position of being offered training courses in homeopathy and Chinese medicine, and acupuncture, and Bach flower remedies. And as these courses came along, we were able to do them part-time, which was very fortunate because being in general practice, one can't take lots of time to go and do extensive studying. So we could do most of the courses on weekend modules. And that way, I kind of built up my repertoire of tools, as it were. And to this day, I still use a lot of those tools in my practice. Now we sort of are more comfortable with the term integrative medicine because we're integrating a lot of these complementary modalities into practice. And we're exploring the functionality of the body and hence the term functional medicine. So, yeah, it was a gradual evolvement. There was no sort of light of Damascus that struck me down and put me on the right road. It was an evolution that took place over many years.
It sounds to me that you were, at the very least, open to exploring homeopathy as your first step.
Very much so. My wife had trained as a naturopath and reflexologist and aromatherapist at that stage. So I was curious to know what she'd learned, and certainly that opened my eyes and to natural alternatives. And when I started using them in the practice, realized that they work well, work better, and often without side effects that pharmaceutical drugs often bring. And one starts addressing the causes of the problem rather than just the symptomatic treatment, which is so much a part of conventional medicine.
And so, would you like to share a little bit about your journey from then until now? How did you progress, and how did things change for you?
Yeah, that was in the 1980s and 90s. We were all talking about complementary medicine. We had an organization called SACMA, which was the South African Complementary Medicine Association, which incorporated branches with homeopathy and acupuncture and Chinese medicine. And it brought together a lot of like-minded doctors who were looking for alternatives and practicing different modalities. And we actually worked really hard to get dual registration with the Allied Health Professions Council. And finally, they agreed to register homeopathy as a modality and acupuncture and Chinese medicine. And as medical doctors, we were then allowed to have dual and even triple registration with the South African Medical Council as well as with the Allied Health Professions Council. And I was quite involved with the politics at that stage of getting the registrations through. Looking back, we realized it wasn't really such an advantageous thing because it meant that you had to do twice or three times the amount of CPD and you had to pay registration fees for each modality, so that got quite expensive. And in fact, medical doctors have great liberty in this country to practice other modalities as long as they can prove that they are qualified in them or not stepping on the scope of practice of somebody else. So once SACMA came to an end about 20 years ago, integrative medicine really came to the fore and kind of embodied a lot of what we've been trying to achieve with Complementary Medicine Association. Integrative medicine really kind of brought it all together, and we're looking at sort of body, mind, soul treatment and trying to get to the root cause of conditions and treating in as natural way as possible, using pharmaceutical drugs where we have to, but trying to use them far less. And generally the results are so much more satisfying. So that's where integrative medicine came to the fore, and then the development of SASIM as an organization brought all of us together, and it's grown nicely since then.
And I think another big key is also looking at the lifestyle a lot in integrative medicine, isn't it?
Absolutely. Lifestyle is key to 90% of people's health problems. Looking at past traumas, looking at how they handle stress, how to deal with stress, how they deal with sleep, emotional stuff. I'm trying the Bach-Frau remedies, fantastic for balancing people's emotions. It's a very simple technique, can be learnt in a couple of weekends, and is a wonderful tool to help people with emotional stuff. I often find that people can get off their antidepressants or other medications by using flower essences, and they're just very easy and natural to use.
And nowadays the mental health is so much being spoken about. Do you think it's particularly useful for us now?
I think so. I mean, anxiety is just rampant, especially since COVID.
Yeah.
I think since COVID, everybody has got far more anxious, stressed, and flower essences work beautifully within a day or even a few hours to balance those emotions. And
so my next question is, how do you see your patients benefiting from holistic care? I mean, you've covered it a little bit. Is there perhaps some examples that you would like to give?
Yeah, it's hard to think of specific examples right now. I think that most of them benefit from being heard, because so often they go to many doctors and they're not really heard. You must have to really listen to your patient to understand their frustrations and where they've been and what they've tried and what they haven't tried and what's worked and what hasn't worked. And so often the patient will really benefit just from being heard. And they've often fed that back to me, that it's nice to be listened to and heard. I think the main benefit that people get, having as many tools in your toolbox as possible, means that you have a much better chance of getting to the root cause of their chronic illness. Integrative medicine is fantastic for dealing with chronic illness, which is the major part of illness in the world today. Conventional medicine is fantastic for acute and emergency medicine, and can't be replaced in that sense. But integrative medicine is fantastic for chronic illnesses, and chronic illnesses often have very complex causes and multiple factors. We need to look at, are there past traumas causing the problem? Is there perhaps mental toxicity from mercury fillings causing the problem? Is it lifestyle? Is it food? Food sensitivities? There are so many reasons and factors that one needs to explore and look at. And following an integrated approach, you have access to all these different thought processes that can really help patients.
It also sounds to me as if you take a lot of extra time. It's not such a fast in and out appointment as we would normally be used to.
You can't practice integrated medicine in a 15-minute consultation. NHS in the UK has an 8-minute consultation. So we need to look, most of my colleagues, I think, will use at least an hour for the first appointment. Some go even as far as 2 hours. And one needs time. And that's even including getting all their background by means of a questionnaire before they come to see you, which helps to focus the consultation on the areas that really matter. You don't have to spend the whole time digging for where the problem areas are. You get that from the questionnaire. And then you can spend the full hour exploring further into where that is. But you need time. And patients appreciate having the time to be heard and to have the problems explored thoroughly.
The psychological benefits already of somebody making time for you and not seeming rushed.
Even just
absolutely
listen to already has about a 30% chance of causing healing.
So, is there perhaps a golden nugget that you would like to share with allopathic doctors at this point?
Yeah, I think be open-minded, because so often allopathic doctors are brought up to believe that evidence-based medicine is the only way to go. And integrative medicine is very much evidence-based medicine, but it's not pharmaceutically supported. So it doesn't come across the airwaves of conventional doctors generally, because most of their education is pharmaceutically supported. So I would say, yes, be open-minded, be prepared to look at things that patients have found worked, explore those things with an open mind, try and develop more tools than just pharmaceuticals and surgery. And having more tools in your toolbox really helps. And listening to your patients and giving them the time to express their frustrations can be very helpful.
I think a key difference that's coming up for me now is also that there's a partnership between the doctor and the patient in integrative medicine. It's not you don't have all the answers. You also listen to your patients and what they've been able to find out, perhaps.
Exactly. I say to the patient right in the beginning, we're going to make a team, and your feedback and your input is just as important as mine. It's not a sort of a doctor is God kind of patient, listen to everything or else kind of scenario,
Yes.
because we learn from our patients too. If a patient has got a particular condition and they explore it and spend hours and hours on the internet, they can give us valuable information which can improve our knowledge as well. So we learn from each other, and it's very much a team approach. You know, what's going to work for you, what's sustainable for you, what's affordable for you.
Yeah, I just wanted to comment that it reminds me of the big difference also being the real humility that our members seem to show and the curiosity to constantly be learning. And I think that really puts a patient at ease. You know, your doctor is not just coming with preconceived ideas. You can explore some things together. I think that helps a lot.
And I've been amazed at the development of integrative medicine worldwide, that I just can't keep up with the pace that we have to learn new stuff. There's so much new stuff all the time, so much evidence-based stuff that it's hard to keep up. And conventional medicine is almost easy because, you know, you kind of rely on what you learned before, and not terribly much changes. Whereas in integrative medicine, it's a very rapid learning curve, and we're learning all the time. And it's fascinating for that reason, because we never get bored. And there's so much more to learn, and one just wishes there was more time in the day to devote more time to learning and reading. And yeah, it's a wonderfully fascinating and very fulfilling path to follow, because you're providing satisfaction to most of your patients, whereas they didn't have satisfaction from conventional approaches. And for self-enrichment, you're just learning so much interesting stuff.
It's also exciting medicine, it sounds like to me.
Very exciting, yeah. Yeah, no, one can really embrace it with passion.
How has SASIM impacted on yourself as a person, as a doctor, and also on your practice?
Well, I've seen SASIM grow from a very small organization to what it is now, and it's become a very comprehensive association of like-minded practitioners who share problems, information, helpful hints, tips with each other on a daily basis, which is a fantastic resource to be able to dip into, to be able to ask a question, where do I find a good specialist, or help me with this problem. It's an amazing community of at hand, almost instant connection. So it's really grown into a wonderful fellowship of like-minded practitioners, humble beginnings, which has been amazing.
Supportive community, huh?
Yeah.
And you as a person, how does that support you as a person?
I turn to SASIM community groups often to help with answers that I might be struggling with, or resources that I'm struggling to find. So it can be very helpful in finding those sort of answers. Unfortunately, since COVID, we don't have face-to-face get-together meetings much anymore, which was a very enjoyable part of local community fellowship. So that's sorry we don't have much of that anymore, but because SASIM is a nationwide organization, it's difficult to engage in that because everybody's so far apart, spread apart.
Always pros and cons to technology. Fortunately, I could speak to you today without traveling to Cape Town.
Mm.
How do you see the future of integrative medicine in South Africa and the world?
I see integrative medicine becoming mainstream medicine and conventional medicine falling very much to the wayside. I do think it's the medicine of the future.
Exactly. So, do you have any last message you would like to share?
I just love being part of the integrative medical community. It's wonderful to know that there are colleagues who are like-minded, who can refer people to, who support you with difficulties, and who help enrich your knowledge by sharing so freely with each other. So, yeah, that's what I love about it.
And could I also say thank you so much for your very important contribution and long-standing support of SASIM from the very beginning. We are really blessed to have you on board.
Well, it's been a fun journey all the way along.
Thank you, David.